Hi, this is Dr. Farley. I'm going to be going over with you today the heavy metal testing. Again, what we find is, these are more toxins that we see out there. We're getting them sometimes through our food source. So conditions and symptoms associated with heavy metal toxicity can include neurological symptoms of cognitive decline, memory loss, ataxia, tremors, numbness, tingling, neuropathy, myopathy, Alzheimer's disease, multiple sclerosis, paralysis, Parkinson's, tinnitus, irritability. Boy, sounds like a lot of the patients I see. Respiratory symptoms. They can be lung disease, lung cancer, breathing problems, respiratory disease, pneumonia. Cardiovascular and hematological symptoms, which is anemia, RBC abnormalities, hypertension, low blood pressure, hypokalemia, edema, cancers of the blood. Gastrointestinal symptoms. Nausea, vomiting, diarrhea, abdominal pain, reduced absorption of nutrients, particularly of the essential minerals. Dry mouth, metallic taste, pancreatic cancer. Skeletal and bone-related symptoms, osteoporosis, reduced bone mineral density. Dermatological symptoms, skin, dermatitis, eczema, dry skin, sweating, skin lesions, hyperpigmentation, hair loss, allergic skin reactions. Renal and hepatic symptoms, renal failure, elevated liver enzymes, hepatic damage, hepatic failure, suppressed hepatic detoxification, elevated hepatic enzymes. By the way, hepatic means liver. Reproductive symptoms, infertility, difficulty conceiving, birth defects, miscarriage. So, again, this is a major issue here. In this test, what we look for is beryllium, aluminum, nickel, arsenic, palladium, cadmium, antimony, tin, tellurium, cesium, barium, gadolinium, tungsten, platinum, mercury, lead, thallium, bismuth, thorium, and uranium. Okay, so if we find these, we'll go over with you what it means. We'll go over with you what you can do to lower these. I do want to point out a few that are really important. So the halides, when you look at the table of elements, the halides are over here. Under those halides is iodine, chlorine, fluoride, bromide, and one or two others. But those four are very important. The only two that are required for proper physiology and function inside of you, the other ones are all toxic, is iodine and chlorine. Now, you can get an overload of chlorine, so we want enough but not too much. But most people are iodine deficient. Also, all of those will compete with each other inside the gastrointestinal system and on receptors in every cell in your body and your brain. Plus, your thyroid hormone will become inactive if we have a high amount of those halides, which again are poisonous metals, coming in, and we want them to be at a certain amount. So we'll have another whole video of that, but just know we tested you on these. We're looking to see are you have normal levels, high risk, and then from there we can track you over time. Again, we're not going to jump in and tell you to start talking about doing a massive detoxification plan, especially if you're a very sick patient. We know what we need to do. We need to restore the normal functions of detoxification. That is absolutely part of brain-gut connection, food-gut connection, gut, liver, gallbladder, proper gastrointestinal system, proper microbiome, many, many different things. So we'll be going through this with you. If you have any questions, let me know. And thank you. Have a great day.